Trump's former Surgeon General Jerome Adams has openly called for President Donald Trump to remove Robert F. Kennedy Jr. from his role as Health and Human Services Secretary, warning that his leadership is undermining public health, eroding trust in federal institutions, and putting vulnerable communities at risk. Adams, who served as Surgeon General under Trump between 2017 and 2021, voiced his concerns during an interview, insisting that Kennedy's tenure is destabilizing key agencies such as the CDC, FDA, and NIH. His intervention adds weight to growing bipartisan and professional backlash against Kennedy, whose controversial views on vaccines and health policy have long drawn criticism. Adams stressed that Kennedy's policies limiting vaccine access are disproportionately harming Black, Hispanic, and Native American communities that were already hit hardest during the COVID-19 pandemic. He expressed alarm at the chaos within the CDC, pointing to Kennedy's decision to fire recently appointed CDC Director Susan Monarez and to replace the agency's advisory committee on immunizations with vaccine skeptics. Leading medical organizations including the American Medical Association and the American Academy of Pediatrics have declared their loss of confidence in the CDC under Kennedy's leadership, warning that decades of scientific progress are being jeopardized. Kennedy's leadership has triggered a wave of resignations from senior health officials. Dr. Demeter Daskalakis, who ran the CDC's Immunization Center, resigned in protest and condemned Kennedy's agenda as anti-science and dangerous. Over 1,000 current and former HHS employees signed a letter demanding Kennedy's resignation, describing his policies as a direct threat to the nation's health and calling on Trump to intervene if Kennedy refuses to step down. In Congress, Kennedy faced a storm of criticism during a recent Senate hearing. Democratic Senator Raphael Warnock labeled him a hazard to the health of the American people, while Senator Ron Wyden accused him of a reckless disregard for science. Even some Republicans have privately expressed concern that Kennedy's actions are destabilizing the health system and alienating public trust in federal health agencies. The pushback is not only political but also deeply personal within Kennedy's own family. His cousin Joe Kennedy III recently criticized him publicly after the Senate hearing, fueling a visible split in the Kennedy family over his role in government. Beyond family tensions, Senator Bernie Sanders has also urged Kennedy to step down, describing his leadership as dangerous and irresponsible. Critics argue that Kennedy's handling of major crises has further eroded confidence. Adams himself earlier condemned Kennedy's failed response to a shooting at CDC headquarters, which he said demoralized health workers and showed poor leadership during a time of tragedy. Combined with sweeping policy changes, this has left many public health experts warning of institutional collapse at the very agency that once served as the world's gold standard. The implications of this crisis are profound. By limiting access to vaccines and empowering figures who question established science, Kennedy risks fueling vaccine hesitancy at a moment when public health depends on rebuilding confidence after the pandemic. Minority and marginalized communities, already vulnerable, are now facing new barriers to critical care. Internationally, the turmoil threatens America's reputation as a leader in science-based health policy. Adams's call for Kennedy's removal underscores the urgency of the situation. Coming from a former Trump official, his warning cannot easily be dismissed as partisan. Rather, it reflects a broader alarm within the medical community, that public health is being politicized at the expense of people's lives. For Trump, the decision carries heavy consequences, whether to stand by Kennedy and risk deeper institutional damage, or to remove him in an attempt to restore trust in the health system. As bipartisan pressure mounts, the controversy over Kennedy has become not only a test of public health policy but also a measure of Trump's willingness to heed expert warnings. The outcome could shape not only the administration's legacy but also the long-term strength of America's health institutions.